Hi, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. Angina is a medical condition in which portions of a patient's heart do not receive enough blood and oxygen for normal activity. Your heart is a muscle about twice the size of your fist and is located right beneath the breastbone. Since your heart must beat constantly to keep you alive, it must receive a constant supply of blood and oxygen in order to work properly. This supply originates from two large hollow tubes called the left main and the right main coronary arteries, which run on the surface of the heart. The left main coronary artery is the more important of the two, supplying about 70% of the blood to the heart muscle itself. Smaller arteries that branch off of these two major ones are ultimately responsible for the supply of blood and oxygen received by your heart. The work of the heart primarily depends on two things. First, the number of times your heart beats per minute, called the pulse rate, and second, the top number of your blood pressure, referred to as the systolic pressure. Whenever we measure your blood pressure, we record two numbers. The top number is called the systolic and the bottom number is called the diastolic pressure. The systolic blood pressure is the highest pressure achieved during the cardiac cycle of squeezing and relaxing. The diastolic blood pressure is the lowest blood pressure that occurs during the cycle. When pressure is measured in the large arteries of the body, a tracing like this is seen. The blood pressure increases when the heart is actively pushing blood into the arteries. When the heart muscle squeezes the blood out, work is being performed. This period is called systole. The blood pressure decreases when the heart has finished its work, relaxes, and refills with blood. This relaxation period is called diastole. When pressure is measured inside the heart during the pumping cycle, you can see a pressure curve like this. Again, the heart squeezes the blood out. The pressure increases until the heart is emptied. When the heart relaxes, the pressure falls close to zero. As the heart fills with blood, the pressure starts increasing again until the heart is full and then drops again after the heart finishes pumping the blood back out into the arteries. The main difference between the pressure curve inside the heart and the pressure curve in the arteries is when the heart is at rest or in diastole. During diastole, the pressure inside the heart falls much lower than the pressure inside the arteries. When the heart squeezes blood out, the pressure inside the heart is greater than the pressure in the main artery coming out of the heart, called the aorta. During this time, the heart muscle itself receives no blood and oxygen. It is only when the heart is in diastole, or the relaxation phase, that the aortic pressure is greater than the internal heart pressure, causing blood and oxygen to flow into the coronary arteries, supplying nourishment to the heart muscle itself. Because the heart only works in systole, the work of the heart will be roughly equal to the systolic blood pressure multiplied by the pulse rate. The work of each beat will be proportional to this shaded area. However, the flow of blood to the heart is depicted by this shaded area. This area is the difference between the blood pressure in the coronary arteries and the blood pressure inside the heart muscle during the relaxation phase or diastole. Normal heart function depends on the proper balance between the work of the heart and the supply of blood and oxygen to the heart. Whenever you exercise or become upset, your blood pressure and heart rate increase, thereby increasing the work of your heart. This increase in work must be matched by an increase in blood flow to the heart itself. Unfortunately, when your pulse rate goes up, the amount of time that the heart spends relaxing and receiving blood and oxygen from the coronary arteries is reduced. This reduced time for the heart to receive blood and oxygen, in addition to the greater work being demanded from higher pulse rates and blood pressures, is what limits exercise in every person on earth. Therefore, you should know that even a healthy heart fed by completely normal coronary arteries can become low in oxygen if physical and emotional stresses are too high. A normal artery, if cut crosswise, would look like this with plenty of space for blood to flow. A blocked artery that is cut on its side would look like this. As you can see, the space for blood to flow is dramatically reduced. As earlier stated, when you start exercising or become emotionally upset, the work of your heart increases. The additional blood that the heart needs may not be met due to the reduced blood pressure in the arteries past the area of blockage. This imbalance between the amount of blood and oxygen that the heart muscle needs when working and what it can receive from the blocked arteries is what produces angina. Angina usually produces pain in the chest, throat, jaw, arms, shoulder, or in the upper part of the stomach. These pains are generally not pleasant and usually cause an individual who is either upset or exercising to stop. Then the blood pressure and pulse rate decrease and the requirement of the heart for blood and oxygen drops. When the heart's demand for blood and oxygen drops below what can be supplied to it through the blocked artery, the imbalance is corrected and the pain goes away. This is classic or exercise-induced angina. This type of pain is very predictable and depends on the blood pressure and the pulse rate. When many people experience angina, they also experience shortness of breath, sweating, nausea, or lightheadedness. These, however, do not have to be present. Occasionally, people do not experience any chest pain whatsoever, and they only experience shortness of breath or nausea. This is particularly true in patients who have diabetes. An additional problem that occurs when people develop angina is an increase in the diastolic blood pressure inside the heart. This increase in the diastolic pressure reduces the blood and oxygen supply to the heart during its relaxation phase. In review, there are three things which can be done to reduce and improve angina. They are, first, lower systolic blood pressure to reduce the work of the heart when it beats. Second, lower the diastolic pressure inside the heart to improve the supply of blood and oxygen. And third, slowing the pulse rate to reduce the work of the heart and increase the amount of time that the heart can receive blood and oxygen from the coronary arteries when it is relaxing during diastole. Another form of angina can occur in patients with heart disease called variant angina. This type is not caused by an increase in heart work, but by a sudden decrease in the supply of blood and oxygen to the heart. The most common cause of this type of angina is from spasms in the arteries that feed the heart. Each heart artery is surrounded by a layer of smooth muscle, and in the normal state, this muscle is relaxed and there is plenty of space for blood to flow. If this muscle gets stimulated, for example, by the products in tobacco smoke, the smooth muscle contracts and causes spasms in the arteries feeding the heart. When this occurs, the space for blood to flow is dramatically reduced. If the blood supply is reduced to the heart muscle without a reduction in work, then a temporary imbalance occurs. This imbalance will produce the same chest pains and discomforts that are felt in classic exercise-induced angina. In most cases, these spasms that occur are temporary and no permanent damage occurs. However, if the spasm lasts too long, then a blood clot can form and completely stop the flow of blood to part of the heart. If this blood clot is not dissolved quickly, part of the heart will die. This is a heart attack. This is why it is important to prevent and treat artery spasms which produce angina. Some heart patients have both classic angina and variant angina. This type of angina is called complex angina. Putting this together, there are three basic types of angina. The first type is classic or simple exercise-induced angina, which is caused by blockages in the arteries feeding the heart. It is very predictable and will occur when the heart rate and blood pressure become too high. The second type is variant angina, which occurs when there is a sudden reduction in the supply of blood to the heart caused by artery spasms. This type is unpredictable and may even occur at rest. The third type of angina is a mixture of the two called complex angina. When you review the causes of angina, several forms of therapy are obvious. One form of therapy is to reduce the work of the heart by lowering blood pressure and slowing the heart rate, as previously mentioned. Another form of therapy is to improve the supply of blood and oxygen to the heart by lowering the pressure inside the heart when it is relaxing in between heartbeats. The final form of therapy is to prevent the sudden reduction in blood and oxygen supply which comes from artery spasms or blood clots. One major class of medications for angina are called beta blockers. These medications work by slowing the heart rate and lowering blood pressure. By doing this, these medications also reduce the work of the heart, thus improving the heart's supply of blood and oxygen. As a result, they are very effective in treating classic or exercise-induced angina. The calcium channel blockers are another group of medications which are used to treat angina. Calcium channel blockers cause the smooth muscles surrounding the arteries to relax. This prevents spasms in the arteries that feed the heart and lowers blood pressure by lowering the resistance to blood flow. This reduction in blood pressure actually improves the flow of blood to the body. Some calcium channel blockers, such as diltiazem or verapamil, also lower pulse rates. For these reasons, calcium channel blockers are very effective in not only improving classic exercise-induced angina, but also in preventing variant angina, the type that occurs due to the sudden reductions in blood flow to the heart from artery spasms. Nitrates are another important class of angina medications. They work primarily in two ways. First, they reduce the blood pressure within the heart during diastole when the heart is relaxing and filling with blood. This improves blood flow to the heart. Second, nitrates prevent spasms in the arteries feeding the heart. In patients with exercise and variant angina, it is often necessary to use beta blockers, calcium channel blockers, and nitrates. This makes sense when you realize the different ways that angina can be produced. Another form of therapy for patients with angina is to improve the flow of blood to the heart through revascularization. There are basically two forms of revascularization for the heart. One is coronary artery bypass surgery, and the other are catheter-based interventions such as PTCA or balloon therapy. These forms of therapy improve the blood flow by clearing out obstructed coronary arteries when possible, or through bypassing them with artificial arteries created by the surgeons from the veins in the leg. This is covered in detail in our video on the surgical therapy for angina. The final area of therapy for angina are medications which prevent blood clots from forming. Aspirin is the most commonly used medication, and it works by thinning the blood. Aspirin has been shown to reduce the risk of having a heart attack by 30 to 50% in patients with heart disease from blocked arteries. For this reason, it is recommended in virtually all patients. In the average adult, the best dose of aspirin is 2 baby aspirin per day or 1 adult aspirin every other day. Aspirin should be avoided in patients with aspirin allergy, in many or most patients who have bleeding ulcers, and in some patients with bad kidneys. Finally, the problem with the vast majority of angina patients is the cholesterol that is built up in the walls of the arteries feeding the heart. You can limit further buildup by taking these preventive measures. First, eat a proper diet. Second, exercise regularly. Third, keep blood pressure and diabetes under control. Fourth, take cholesterol-lowering medications. And fifth, avoid the use of any tobacco product. In summary, angina is caused by an imbalance of supply and demand, an inadequate supply of blood and oxygen to the heart, or increased heart work. The heart work depends on your blood pressure and pulse rate. The supply of blood and oxygen to the heart is affected by many factors such as pulse rate, differences in diastolic pressures inside the heart and the heart arteries, and the space inside the coronary arteries for blood to flow. Reduced space for blood flow can occur due to cholesterol buildup, spasms, or blood clots in the arteries. The primary cause of a heart attack is blood clot formation in the arteries, which completely blocks the flow of blood to the heart. The medical therapies for angina are designed to correct these various problems and prevent heart attacks. It is common for patients to require more than one form of therapy, particularly in patients who have both exercise-induced angina and angina due to coronary artery spasms. The major difference between angina and a heart attack is that a heart attack causes permanent damage to the heart. Angina doesn't cause permanent damage and is totally reversible. I hope this educational video has helped you better understand the nature of angina and what we can do together to improve not only the quality of your life, but also the length of your life.